Distinguished guest speaker, Honorable Dr. Bhagavandas Rai sir, Professor and Head, Department of Oral and Maxillofacial Surgery, Dr. Shalu Bansal, Professor Dr. Akshay Daga, all the respected HODs, teaching faculty, postgraduate students from every arena, and all the attendees who have joined us today online and offline for their precious presence. We are pleased to host this online webinar for exam-going MDS students.
This webinar is going to be streamed live on our college YouTube platform and online platform simultaneously. The moderator for the program for Note My Mail will be Dr. Shalu Bansal, and for YouTube is Dr. Akshay Daga. Very well said by someone that success often hinges on getting the right advice or support from the right people. The right people in your life are no mentors. A mentor can have tremendous impact on your self-confidence, boost your energy, and polish you to reach the zenith, both professionally and personally. To pass through the exam with flying colors is one of the keystones in our life, and we need special guidance and advice for preparation. To accomplish the same, the Department of Oral and Maxillofacial Surgery have organized a webinar on Final MDS exams are coming, get ready. To guide us for the same, we have with us Honorable guest Dr. Bhagavandas Rai sir. Now I request our respected Dean, Professor P. Mahesh sir, to take over the dais for the welcome note.
Good morning, sir. Dear students and guest speaker for the today's lecture, Dr. Bhagavandas Rai, sir. On behalf of the management, faculty and students, a warm welcome to all the postgraduate students who are attending this webinar on Final MDS exams are coming, get ready. Sir is a very senior oral surgeon, a wonderful academician, a good speaker, a good scholar. No words to explain sir's capabilities. You are very fortunate to have him his lecture today just before your exams. Sir, I welcome you, sir. Please start your lecture so that the students will be benefited out of your experience and your guidance. Thank you, sir.
Thank you, sir.
Thank you very much, sir. Now I
Dr.
request
Shalu, I'll
Dr.
be.
Shalu Bansal, Professor and Head, Department of Oral and Maxillofacial Surgery, to introduce our guest speaker.
A very good morning to all of you present here. As we all know that the knowledge is the power. I always say this line to my students that this is the only thing that nobody can take it from you. Read and learn because it is going to enhance your knowledge. It helps you to grow and it will take you to the place where you actually want to go. For that, as already been said, that the right guidance is the key. And we are lucky to have a teachers of teachers, Dr. Bhagavandas Rai sir, amongst to guide all of you to sail through the journey of your final MDS exam. I am taking this opportunity to briefly introduce sir. Sir has obtained his bachelor degree from A.B. Shetty, Mangalore in 1993 and his master's in oral and maxillofacial surgery from Bapuji Dental College in 1996. He is having a vast experience of teaching and guiding the undergraduates, postgraduates, and the PhD students for more than 25 years. He is presently working as a Dean, Faculty of Dentistry, Pacific Academy of Higher Education and Research University, Udaipur. Sir is also elected Vice President of AOMSI, CC member of IDA Head Office, Board of Management member of Sai Tirupati University, Udaipur, Board of Studies member of JSS University, Mysore, member of the DCI Committee for OMFS Curriculum Reforms in 2020. He is presently also working as a DCI inspector. Here, I was just able to enlist only few of his accomplishments. Of course, the list is longer than that. Now, I humbly request our honorable guest speaker, Dr. Bhagavandas Rai sir, to enlighten all the PG students and help them to breeze through the university exam. Over to you, sir, and I'm making you the presenter. At the same time, I request all the students to kindly put down your question on the note my mail so that we can forward these questions to Bhagavandas Rai sir. And I'm sure that sir will be happy to answer your questions. Sir, I'm making you presenter right now.
Okay. At the outset, I would like to thank the Swargiya Dadasaheb Dental College and Hospital, Dr. P. Mahesh, Oral Surgery Head of the Department, Dr. Shalu Bansal, Akshay Daga, and all the people today who are attending
So your
this
voice is breaking
and
in
having inviting. Okay. Okay now. Network. I'll just increase this thing. Am I audible now?
Yes, sir. Your voice was breaking in between. Can I request Dr. Rashri to put your phone on
Okay.
mute mode and Dr. Siddhant?
Okay. On the screen right now.
Sir, you want me to upload your presentation or you will, I have make you presenter, sir?
No, I'm sharing it. Just see.
Yes, sir, yes.
If
Sir, till now it's not there. Yeah. Now we are able to see it, sir.
is it okay? So once
So
again,
give
I
us
would
a
like to
moment.
thank the entire management. Management, principal, faculty, inviting me for this particular topic discussion. Experience on MDS exam preparation. MDS exam preparation a lot, not during the exam. It starts well behind. The documentation or the preparation is the examination process. So the daily records which you try to maintain, the seminars, journal club which you present and you document the examination process. So what exactly happens at the end of 3 years is the evaluation or the assessment which takes place is the culmination of the 3 years which you have done, plus on the particular day certain is done to check your practical skills. So these put together is a process which takes place at the end of 3 years. So I go to the details of the exam process or the assessment of 3 years. Probably we need to know into the minor details in the preparation of those things. So as we all are aware, MDS examination is a two-part thing. One is the theory, is the practical aspect of it. Unlike the medical side, just by your clinical or practical skills which you demonstrate on patients, which usually does not happen on our medical undergraduate itself. We have exhibited our clinical skills, whether we have done impression making or we have done cavity preparation during undergraduate. The same thing is taken one step ahead and during the assessment of the MDS. As we know that the change has taken place from last 2 years, that is the exam happens in the end of first year and the remaining 3 papers 3 years. So the theory is for 400 marks, examination is of 300 marks. So out of the 300 marks, clearly for the practical skills which you are going to have which particular day. The 100 marks will be for the pedagogy and 20 marks for that and 80 marks for the viva voce. I'll be talking about this in detail. So the applied basic is common for all the MDS branches is of 100 marks, 3 hours paper, 10 questions, 10 marks each, and 100 marks paper. So this has before you appear for the part 2. So every 6 months this exists. So you can appear as many times as possible, but if attempt itself, it helps in your understanding and doing it much better. So postgraduates who are there, some might be in the first year or some might be in the third year. Even the first years who are there need to prepare for their basic first year. They would have just entered the first year because of the late admission. Otherwise, 6 months would have been passed by this time. The part 2 exam, which is at the end of 3 years, earlier most different categories. Some university used to have an 100 marks paper, some university. Right now, by and large, it is uniform, having 300 marks paper. In each of this also, there is further categorized as 25 marks long essay and 5 marks questions, 2 notes of 5 questions, 7 marks each, which will make it to 100 marks each. 5 questions of 10 marks each and questions of 25 marks each, so makes it 100 marks paper, and that is of papers which are there. The third paper, which is an essay question, also which has questions now available. Earlier, which there out of 2, you had a choice of writing 1. So right now there is 3 questions. Out of this, you are supposed to attempt for 2. So each question carrying. So you have to hear the theory by all the universities follow these particular guidelines, and a practical exam separately. So out of this 100, you are supposed to minimum, and in the practical examination, even it is 2 marks for the clinical skills or practical skills and 100 and pedagogy. So in case of oral surgery, oral medicine, or GP, it will be having a procedure of 100 marks and 100 marks. Depends on branches to branches. I'll be talking in detail. I have taken just for example, in 100 marks goes for a practical skill assessment of surgical removal of an impact, and removal goes for a long case and 2 short cases. So same way in each of these marks. So we need to understand how the process goes on. So coming to the theory aspect of it, as we all know, the applied basic science. So each questions, the topics have been mentioned. So it involves applied basic anatomy, physiology, chemistry, microbiology, pharmacology, research methodology, biostatistics, growth and development, and some applied aspects in relation to a particular subject. It can be genetics, or it can applied dental materials, depending upon if it is a prosthetic, then applied dental material. So we need to be abreast of what exactly 10 marks each, 10 questions which come into that particular paper. Then we have the remaining 3 paper at the end of 3 years, which case, part 1 depends about the basic. In case of oral surgery, in trauma, or for example, in conservative dentistry, it can be conservative dentistry, it could be endodontics, or for example, in case of oral medicine, paper maxillofacial radiology, and paper 2 might be oral medicine, therapeutics, and the part 2 paper, so forth. It varies from branches to branch. Paper 4, a paper 3, which is there, that is a descriptive and analyze essay type question where you have to answer 2 questions will be there. So mentioning these topics, how a strict division of the topics becomes difficult. The mapping of the topics is inevitable, so students should be prepared to answer topics. You cannot say that this was not part of the syllabus, so I am not prepared for this. You need to prepare for the overlapping of the topics or the subjects. So you might expect on the paper 1 itself at the end of 3 years when you are trying to give it about the theory aspect of it. How to prepare for the practical exam. So the exam preparation includes, as I told in the beginning itself, your which you have done, you have to keep it, you have to exhibit it, what you have, plus you have to keep your logbook update teachers, because even there is an assessment of that which will be, don't have exactly any specified marks there, but it helps in assessment of a postgraduate during the exam, because might be stressed. Everybody who undergoes an examination process will be stressed. Due to certain stress, certain procedure may not go as you want. So in that process, you might get further apprehensive and not go well. So in that process, the 3-year culmination of the work also comes into role. So the clinical examination is designed to test the clinical skill, performance, and competence, especially in the skills such as the communication skill of the postgraduate, the examination, how you have done, how effectively you have done your clinical and dental procedures or prescription which you are giving, the latest, well, you are abreast with the latest techniques, evaluation and interpretation. Suppose you have the investigations, lab investigations which have been done, which has been done, how good you are at the evaluation process as well as the interpretation. So finally, all these things are important to assess into the work as a specialist. Because as you are aware, MDS is the highest degree, which is considered by the Dental Council, though PhD in other branches to become a teacher or considered, excuse me, in India, dental teaching, it is not mandatory to have a PhD program. This is the highest degree. So the second day, usually the of the patient work, the second day is viva voce and pedagogy, 20 marks each. Usually the viva voce is conducted by there are 4 examiners are there, 2 external and 2 internals, who need to assess the comprehension, analytical approach, integration of the data and communication skills, includes the components of the course on the dissertation. This is part of the thing which happens there, and not to prepared with the particular theory paper which you have given when you go for exam. This applies in every branch of dentistry when the MDS. Pedagogy or pedagogy, how it is pronounced, can be pronounced convenient to us, however we feel like. It's called pedagogy or pedagogy. It's an exercise which is done, given on the previous day, allotted at the time of the clinical examination. You are asked to make a presentation of 8 to 10 minutes. However, it's mainly done to assess your teaching skills. Pedagogy, go by literally, the meaning is the method and practice of teaching, especially academic subject or a theoretical concept. If you see it, pedagogy is the study of teaching approaches and how they affect the learners. So exactly, it should be given a topic, how you are effective in teaching that given time, in 8 to 10 minutes time, a small topic. All audience is provided. They might be a postgraduates of your own there, how you have covered that particular topic which is given to you, how effective you are able to transfer that particular thing, concept to you are in finding out whether they have understood or not. That is part of the teaching. This is pedagogy is meant for. But we tend to hear it. Extended viva takes place in pedagogy. Actually, in pedagogy, the teacher is the basically topic, how good was the presentation, did he cover all, confined to the given time, that is most important, rather than the topic of that particular thing. So that is up to 8 to 10 minutes. So coming to the basic thing of each subject, orthodontics, periodontics, conservative dentistry, endodontics, orthodontics or pediatric dentistry, everything, as I told, is a 3 examination. 200 marks is very well confined for the practical skill, whether it's a clinical examination or case history, whether in case of oral medicine or the, it all includes that 200. 100 is common in all the branches for as well as viva voce. So if you see the prosthodontic examination from the university, how it divides it, but by and large, it's a 2-day exam. If is not completed, probably it might extend to a 3rd-day exam. So you day 1 and day 2 procedure. Day 1 is usually, which is there, a case history, primary impression, final impression, tentative jaw relation, transfer, Gothic art tracing, interocclusal record, programming of the articulator. So when I impression of the patient or the examination, you need a patient for this, whether you need a Gothic art. Just take a new patient and start doing this. You need to call the patient. He should come here, spare patient in hand. Your juniors should be aware who are the patients coming. They should be that the patient reaches on time and he is there. Well, on the day of exam, particular student is already under stress. So it's a part of the department to help their seniors in facilitating the patient to this. The process will be done by the student, the postgraduate who will be assessed, but facilitating to reach there on time and preparation of the patient will be who are there. Afternoon session, there is an FPD case, retract, final impression, which is there, introcclusal records of generation of the provisional restorations which are there. So they has been explained there, and which also includes pedagogy. So prosthetic is an which doesn't end only at the clinic. There is a lab work which is again done by the postgraduate student evening hours. So it can be, it is not necessary or mandated. Examiner might come during your lab work to see whether you are doing by yourself done by the technician. This happens at most of the places. So if you know the lab work, you can be very helpful for you, as if at all it is assessed, you will be each and every question, even though the casting procedure goes wrong, if your age went wrong, it will add up to your assessment process. So the treated patients and record during the 3-year program, as I told. So then coming to, if it is periodontology, the day one has a long case history presentation, which is 20 marks is allotted for that. A case history presentation, differential diagnosis, and planning. So each procedure is divided so that here. Periodontal surgery is another skill, which is in fact a 100 marks procedure. So 70 for first day, and probably the patient is called on the second day by most of the university, by the dental council regarding this. Individual universities frame this from university to university, but by and large, most of the universities try to have in this particular procedure. So periodontal flap surgery on the previously prepared one quadrant of the mouth after approval by the examiner. So two patients so that the examiner has a choice to select one. This patient only you have called, and if he fails to turn up, it will be a problem. The patient well in advance, the pre-surgical procedures, which is and then you for the one quadrant, and then take up the patient for. Then the patient is reviewed on the second day, post-operative review. Again, a 25 marks can be allotted for the review and the discussion during that particular time. Then there are short case presentations which are there, which carries probably 50 for each. Case history presentation, differential diagnosis, investigation, and so it can be divided. The chart which has been shown there can be utilized. Marks can be divided accordingly. Then coming to conservative dentistry and endodontics, again day one and day one, especially for the clinical assessment. I think this is common across activities, that is cast, post, and core, that is tooth preparation, post cutting, which has to be done, direct wax pattern fabrication, around 90 minutes is allotted and 75 marks. So during the exam, it's very clear about the time allotted to each procedure. If you don't, you'll be losing a lot of time, you will be wasting, and then at the end, you will try to finish it off. When you try to finish it off, what happens is you will not be able to task which is there as defined by or as wanted by the examiner. So fix a time frame for each procedure. It really helps out. Even while take a case history, you can take a case history for 1 hour also. You can take a case history. Even in 25 minutes, you can record all the details. Some person might not be able to do. So you should learn the skill of recording the details or recording the case in the shortest possible time without losing any of the vital things. Class 2 inlays, another part of the process which is there. Direct wax pattern has to be prepared, rubber base impression has to be made, again allotted to that. Plus there is a molar endodontics which at this particular skill. See, dentistry is very fascinating, and MDS, even in an MCH program, super specialization in the medical side, they don't. You have to demonstrate a skill. Whereas forget about in post-graduation specialization. Whereas in dentistry, even at BDS level, we have to demonstrate this. Due to Corona, in the past 2 years, there was some changes at certain probably transferred to simulation, whether it was a pre on a dummy model. But now, since the end of Corona has started, mass immunization has led to good immunity among all the people. Probably when your time of examination comes, probably it will be on the patients itself. So rubber dam application and isolation, access and determination, shaping and cleaning of the root canals, and master code selection. So if you're doing a rubber dam application on the exam day, you won't find it odd. If you try it itself, then it becomes very odd and you are not used to such a working atmosphere. So I always advise every endodontist who tries to go for an exam, do regularly a rubber dam application. That makes you different. Treatment is one thing that every BDS graduate also does it. So if you postgraduate, apart from the quality of work, plus this rubber dam application should be another point which you are comfortable, should make that also one of the difference apart from the skill which you exhibit as an endodontist. So again, the marks distribution, whether it's a case selection 10 marks, post phase 2 preparation, this helps in assessing rather than as the student also should think that okay, my polishing didn't go right. Your case selection was right, your post and space tooth preparation was fantastic, was good, you had done a fantastic cast, except for polishing and cementation, very much if marks will be assessed overall thing. Yes, definitely polishing is needed. Polishing is very important, but that doesn't carry 75 marks. So you need to concentrate. The table which is given is just to assess. So on the cast second day of the examination, the cast post and the core trial and cementation is checked. Apart from that, the pedagogy and bio orthotics and dentofacial orthopedics. This rather little different exam process. One is you have to have discussion which is there, that is on the day one, case history plus preparation and discussion of that particular case. Apart from that, clinical usually around 5 cases which you have started during your 3-year program. You need to put the diagnosis, your mechanics which you have applied. You might have taken up a surgical, you would have taken a functional case, you would have taken a different method which you have mechanics which you have applied. So different variety of case if you are able to present, that adds up rather than showing only one type of mechanics of the case. So variety of the case which can be shown. So prepare a well prepared case. So it should not happen just 1 month before the exam. If you want to present this particular case, well 6 to 8 months before. So you have to show a finished case there. An incomplete case, if you show, that doesn't really show that for the exam. In an extremely a different circumstance like Corona this time, a patient missed the follow-ups or something of like that. Other should have 5 cases at least minimum to present which are complete. And wire bending exercises, diagnosis and application, selection and discussion, again 50 marks each, and a long case discussion on the second day and delivery which is there, which can be allotted 25 marks. So again, for the distribution of the marks, so the treatment planning which is there, treatment planning or the investigations which you have done or the interpretation of the investigation, when the case or the particular technique which you have adapted, how going to affect the action which you have done. So during your treatment, when you the professor or teacher would have told, go ahead with this. But on the exam day, if you are with that technique, you have to defend that particular technique in front of the exam. You opted for it. You cannot say, sir told me this particular, so I did this particular thing. You just technique which is there. So at the same time, again, pedagogy, which is of 10 minutes, which is allotted for that, and viva voce, which is again a common thing which is there. Oral maxillofacial pathology or oral microbiology, which is there. Day one, usually a case presentation, that is 20 marks there. So case history presentation, differential diagnosis, investigation. Here I would like to say that this usually happens most of the time. The same day, some certain universities hold it on the same day. Most of the branches. These are the thing which these are things which are not there in the book. We have to be prepared for it. Because a certain patient for the case pathology might be common for oral surgery as well as for oral medicine also. The suppose if it is a CA patient or a swelling patient, a non-operated case usually, if it is shared with the three departments, the time management between these two and an understanding of the PG as well as the faculty of the three departments should be taken into confidence in case if you are the patient. Otherwise, the patient would not and then the procedure goes here and there, or in that case, the procedure need to be changed accordingly. So this also is part of student who is going for the exam and the exam coordinator should look into this particular aspect. So next is a case presentation, again, which is seen as a case history presentation, differential diagnosis, required and management planning. So even when you are noting down the case history, you should see includes the part of the case history plus your differential diagnosis is very important. The investigations we're going to mention is also important because in investigation you are advising why you are advising, what you are looking for, looking it for that particular investigation, and then when the investigation is done, so you will include that plus management planning. So how you're going to manage that particular is there, how you rule out each particular thing and come to a final diagnosis, what will be your treatment plan. So that has to be charted out very clearly. Methodology, 2 investigations which has to be done, that is 20 marks, hemoglobin estimation or bleeding time, clotting time, or TLC or there, which each one of you should be well abreast about. Smear presentation, 20 microbial smear and staining with PAP or gypsum stain or and paraffin sectioning and hematoxin and eosin staining. This on the day one. So usually on the day two, they have a discussion of slide discussion. Slide is given. So probably you might have to identify the slide microscopically and then discuss that particular thing. 10 slides each. So about that, again, pedagogy and viva voce. So the oral pathology examination scheme plus pediatric. Again, the patient has to be called. So see to that children which you are calling are school-going children. If it is a school-going children, whether they are ready to take off from the school, the day the parents has to be taken into confidence because you doesn't turn up. And at the same time, you would have called not one patient, 2 patients. This applies to all the departments. Suppose most of the time in oral medicine, oral pathology, and oral surgery part, non-operated cases comes. So there will be some excess has to be managed, even for impaction. If you call a patient and if he is just sent on a particular day, the patient will be disappointed and further he might not come. So that has to be taken care. So in pediatric dentistry, there is a case discussion and 50 marks, around 2.5 hours is allotted for that. Pulpectomy on the primary procedure, which is usually asked to do. Then in that case, you can divide 20 marks, rubber dam application, working length, X-ray, and are seen. Case discussion and crown preparation for the cementation of the crown on a primary molar. This is another procedure which is there, with marks and half an hour procedure. So the time is also very important. So you get it there, but you cannot take, if it is 30-minute allotted, you cannot take 1 hour. At 30 to 40 minutes. So that you should be very particular about anybody who goes for examination. Even when you are doing a routine procedure, you try to see at how much time. So you will get an idea regularly how much time you take usually. Start doing it regularly, it really helps. Suppose if you are doing an impact surgical removal of an, I don't need that you have to do in 5 minutes only and 10 minutes or 15 minutes. But regularly tend to see that how much time I routinely take. So time is also an equally just discussion and band adaptation and impression making for a fixed type band and space maintainer, again a 60 marks, 40 minutes is there. So case design and impression making, where marks can be divided. Then on the second day, evaluation of space maintainer and cementation. That is just 20 marks and 20 minutes can be allotted to that. Then again, pedagogy will be there and viva voce will be there. Oral medicine and radiology part, which is again 2-day exam. The day one, they usually again differs, but by and large, most of them try to keep it as common that there are 2 which are there. 20 marks, that means 10 marks each for the is kept. You have to do a spot diagnosis and a treatment plan. Just seeing it. So that is one, to see your skills. Then case presentation will be there, a long case. So how you do the case presentation, because first you have to register or record the case history of the patient, differential diagnosis, investigation. Then there is case presentation of 2 short cases. Is your case history presentation, the differential diagnosis, the investigation. So the sheet which has been given, you are supposed to write all these things in detail. That really helps you while you have been asked to present. If it helps it, don't try to do it just 1 month before the exams or something. This presentation. Then there is a radiology exercise, because it's oral medicine. The radiology exercise includes 1 intraoral radiograph. Though the change has started, there is digital radiograph. Images are there, PSP plates are there, but still as a part of procedure, as a person, oral medicine and radiology person, you should be able to do it in the excuse me, developing assessment in the dark room, how you're going to develop the film. PA, an occlusal radiograph plus 2 extraoral radiograph. The particular view can be decided by the examiners, including technique and interpretation. So the particular technique and interpretation, again 30 marks. So that is how the 200 marks is divided. 100 for medicine, and second day will be pedagogy and pivos. Depending upon the marks, what is there. So if it is short case, you can divide. Major case, you can divide the marks like that. So coming to the last particular part is oral and maxillofacial surgery. Again, there is a surgical procedure of an impacted tooth, which has to be done, which invasive procedure which will be done. You need to note down the case history. The routinely done by every resident of the maxillofacial surgery. So you are able to do it in the best possible way, whether it is the interpretation or taken the patients which you have called for the examination, you should have their investigation should have been done priorly, their radiograph should have been taken, IOPA, whether the patient has a gag reflex or something like that, see to that. And OPG is also there sufficiently ready there. If IOPA is needed, but if it is not available, then an OPG, how much structure should be seen in an IOPA MDS assessment, he should be knowing, he or she, how the X-ray should be seen. Candidate should have an idea, the involvement of the canal, if at all it is there, how do you differentiate between that? You should be able to planning, whether you would like to take it out by odontectomy, section the tooth, or you don't want to section the tooth. In your management plan, stepwise surgical procedure will be assessed, like you give a block, reflect the incision, your reflection, your handling of the tissue. So everything will be seen in this particular. Around 100 marks are there. Case presentation, which is there. And 2 short cases are there. Long case of 60 marks and short cases of 20 marks each, 40 marks. Again, which includes differential diagnosis, investigation required, and management planning. So it can be any surgical. By and large, a non-operated case will be there. In case, it can be a immediate post-operative case, or it can be orthodontic surgery. It can be without any pre-surgical orthodontics also. It can be a cleft patient also. It can be a neuralgic patient, any patient. So you should be prepared to take a proper case history, and you should be able to present the case. You need to be prepared for that, and the chart which is there, the marks can be distributed for removal, 20 marks for case history, then anesthesia, how good you intraoral technique of inferior alveolar nerve block. Usually the surgical removal of taken up, incision and the flap design, which bone cutting, how much you have done, how well you have done, and the section of the tooth which has been done, and how good you have done the suturing. Part of my experience, because I'm a maxillofacial surgeon and usually do routine, go as examiner, I frequently come to know, usually the postgraduate would have been giving 2 sutures. On that particular day, they would like to give 3 sutures. When asked why the 3rd suture, add the releasing also, they don't know, they can't defend, or routinely they don't do. So what I advise is, don't try to do something special on the examination. What you do on a routine day, only try to practice on the exam day. So you also are happy and the examiner also very comfortable. So again, the case history, case or a short case, 4 marks. So accordingly, for the investigation, differential diagnosis, management. So during the discussion, you should be able to talk about all the aspects. coming to the practical examination of oral surgery, I'm a little particular about that. So assessing the competence of you. So suppose you had not this parentectomy, you would have not told about I need to and at the time you would have sectioned it later, you need not have to worry. Treatment would have gone wrong, but still you decided that it is wiser to go for a. In that process, you have saved the patient's bone because the bone belongs to the surgeon. So you have taken the decision in the interest of the patient, of the surgeon, the skills and techniques and procedure, ability to make valid observation. So that is what is assessed. Working out even the root fractures, don't get panicked. Even if the that whether you are able to take it out without being panicked, you can take it out. Even if you have to leave the root back, whether you are able to good, it can be justified, explain to the patient, and you can leave it. It's not take risk. Benefit ratio will be waived, will be seen, and then the minor oral surgery 100 marks. By and surgical drill of third molar is followed everywhere across the country. It can be a small cyst enucleation also. The basic thing is local anesthesia block, whether you know to raise a mucoperiosteal, handling of the tissue, suturing of the tissues back, assessment which is done, where professional skills in raising the flap and removal of the bone and suture. Yes. So having said this, another thing which I have been talking is in the latest gadget of the Dental Council, they have not mentioned any about above, but if you go back to the regulation of the Dental Council, to when it came, it was very about having a two team the for viva voce, one external and one internal, one external and one internal. Each of them will divide the topic. The candidate will go to both the places for. So one external and one internal will take and viva for the stipulated topic divided among themselves, and then the candidate goes to the other side. So they two things. One is when four people sit across and try to take chance. So if the remaining three are blank, and in the given 40 minutes time, probably 3 minutes viva is usually taken. So it all the topics probably which is there, because exactly the candidate knows. So the candidate knows to check each his depth of understanding and knowledge. So it's visible to have two teams, topics divided in not oral surgery alone. So that in a way helps in the time management. There are four candidates. If each candidate you start trying to take a 40 minutes or 4 hours of viva for four candidates. Suppose if it is divided between team and team B, team A will assess for 40 marks and B will assess for 40. Combined together, one external, one internal. So what happens is the candidate 20 or 30 minutes on one side, again on another side, he will come for 20. Simultaneously, viva is going on both the sides for different candidates. Then the candidates, that process, the team will finish their viva. One team will finish 20 minutes into 4 means in 80 minutes the entire viva is completed. So there the remaining part of the things, whether it's the logbook checking, the documentation, seminars which are presented, which also needs to be evaluated during this. So I believe, I hope I have sensitized with this particular aspect of the exam preparation. You have got a good 4 to 5 minimum months now before your theory exam. So I wish this talk, probably I have tried to give a basic idea and an understanding of exam. The logbook is very, very important, and that has to be maintained. Your documentation of the case, preclinical work, ready signatures which you have taken, everything should be displayed during the exam process. So don't waste a good mistake, learn from it. Every mistake is a learning process. During your entire 3-year program, whatever mistakes you have done, that you have wasted something, learn from that mistake, don't repeat it. Thank you. Thank you, everyone. I once again thank the management, Swargiya Dadasaheb Kalmegh College, principal, head of the department, Dr. Shalu Bansal, and Dr. Akshay Daga, and all the team. Thank you.
Thank you very much, sir. Before I let you go, a lot of questions have come pouring into me during your presentation. I
Okay.
will try to take a few of them. Time permitting, I'll try to take a few of them because each department PGs have got their specific questions. And it is really enthralling to see
Okay.
that a person can have so in-depth knowledge about all the subjects. Sir, I'll try to take a few questions which are common to everyone and they have been repeatedly asked. The
Okay.
first question is how many
Okay.
pages are expected to be written in a 10 and 20 question, 10 and 20 marks question. I mean, they are asking basically if the examiner
In a
will look
theory
at
paper.
the number of pages also. Apart from the quality of the answer, does the examiner look at the number of pages also? It's a very candid question.
See, this is a very important question also. See, paper evaluation at various universities is done differently. In certain universities, I'll take some time on this. Some universities, what they do is collected during the 2-day exam process itself. Centers or some of the university. In some of the universities, the external exam correction of the theory paper. In both the cases, paper evaluation is done at a different mindset. When the theory paper starts, suppose for example, university sends me online papers for correction, so I have to log in. So when such a thing comes, probably I am expected to correct some 30 to, there is a minimum of maximum in a per day we can correct. But when you try to correct an online paper, more when you sit on a computer for a correction, anybody gets fatigued. So I'm talking now. So it all depends on so many factors. How you have written the answer, how legibly you have written the answer. So, for example, if I tell somebody has written a neat answer, very good handwriting, doesn't have any substance there inside, relevant to the question asked, he writes 5 pages there, will not carry anything much. Sorry. Matter is written by somebody who has not written legibly, fully read, also is a disadvantage because the examiner will try to look at certain points. Is it been mentioned relevant to the question? Some 4 or 5 points, relevant points will be there, whether mentioned or not. When they can't read the handwriting, they will look for certain things particular to that particular question. If that doesn't appear, candidates tend to lose. So I always try to emphasize whatever you are trying to write in points and try to highlight if you are and you are confident enough that this is relevant to this particular question. So that will really help it. So the number of pages should not matter. If 30 marks question, you can write in 2 pages also. All the points mentioned very clearly.
Thank you, sir. Sir, the second question was, according to an examiner or a person who has taken so many exams, what are the common mistakes while performing practical exams? For example, it's a general question. What are the common mistakes you look out as an examiner in students when you are asking during the grand viva?
See, it depends on examiner to examiner. By and large, examiner should look for the, as I told, the postgraduate examination, which includes on that particular day, though the assessment is confined to the particular day, what you are doing, the marks is divided for the exercise which is there. Also a surgical removal of an impacted tooth or a post and core procedure or but however said, as I told, on that particular day, we cannot depend on that particular day. Suppose that particular day goes wrong, probably goes wrong. So apprehension is there in the candidate's mind. So the remaining procedure might not go as well as it is. So that should not determine the overall that particular thing. That is where I was emphasizing on the three there, the documentation of the law also has to be taken into consideration, and then it has to be clubbed with that particular. And even though the procedure goes wrong, if the student is able to tell, procedure probably might gone wrong. So if he is able to tell why that casting, that means he knows what went wrong, and he knows that he will not repeat it. To be able to defend or justify that particular thing, I think the benefit should be given to the candidate, and that is how the exam should go. It should not be just on that particular day, but unfortunately, most of the time it does not go exactly like that. It see, we are all humans. We are sitting here as evaluators and examiners, so like this.
Correct, sir. So another question was that if the primary patient cancels last minute,
Yeah.
due to these unforeseen circumstances, will marks be deducted on the
Yes.
basis of case selection?
Not exactly. See, during this pandemic, definitely there should. During non-pandemic time, probably each candidate are supposed to. They are supposed to get a surgical removal of impact. That means at least 3 patients he should have called. Out of that, 1 will be selected. In department, if it is a post and core is there, 2 patients should have been called. Out of that, when the patient is not there, there should be definitely consideration. The mark should not be deducted. The same thing, if at all, it can be replicated on a model, then the assessment should be done on the model.
Okay, I think that answers it, sir. Some students find it very difficult to answer in good English, and they are not able to exactly convey what they really want to say. They are not very fluent in English, and they are not able to convey what they want to say during the grand viva. So, if the concept clear and they are able to get the message across,
but they are not able to, convey it properly. Does that
Your
does
voice
the
is
marks depend on that?
cut.
Is one of the questions.
Your voice is getting cut.
Sir, the question is, can you hear me now? Am I audible? Am I audible, sir?
Your voice is feeble. Can you repeat the question? I couldn't hear.
Yes, sir. Am I audible now, sir?
Yeah, very low. Can you repeat the question?
Yes, sir. Sir, the question is that if someone is not very fluent in English, does that also affect the marking system in the Grand Viva?
See, if you see, it should know. Is he able to explain that particular with the language should be accepted. But however, our entire teaching program, higher education is in English. Most of the time, the examiners level, at least certain basic concepts, the candidate should be English. But if you ask me frankly, it should not matter as long as he is able to convey it in whichever language. But examiner, it will definitely not affect considerably. If somebody is going to get 35, somebody gets 45 marks, might vary due to the language problem confined to the some basic concepts. Because it's a undergraduate examination is a different process. He has reached a post-graduation and entire program in India goes on completely in English.
Right, sir.
Certain things, but if you ask me personally, it should be whichever language he speaks.
Right, sir.
Yeah.
So there are many other questions. I'll ask them to give it to me, and I can mail, or we can have I can mail it to you. But due to paucity of time, I'll take one more question. So a lot of students have asked that how important is the presentation when we are writing a paper? Sometimes, due to paucity of time, the handwriting is not very good, and the diagrams which they want to draw cannot be beautified, but they are very symbolic and line diagrams. So, how does that affect the overall marks when the handwriting or the diagram quality is not very good and the paper is very vast? What can they do about it?
See, there is a saying, a picture is worth a million thing, which explains many things. If somebody is good at drawing, he should go ahead with it. He should go ahead with his drawing, label it. So that solves most of the things. If he is good, who is not good at drawing, he should try to depict line diagrams should help. Somebody who is good at drawing should go to actual drawing. Then remaining other thing is framing of the answer. Suppose the candidate is write an introduction. He should write, this is the diagram plan, this is the thing or particular this thing which is there, or categorize itself and then start answering about the question. And at the end of every completely mention the references. The references the mentioned should also be part of the answer, and especially if it is from being quoted or references from the article, definitely will have extra value questions. The examiner will be definitely impressed by the subject, by the particular candidate, and his references will be taking not only from the textbook, even from the journals he is referring and quoting that should definitely make a difference. So in the beginning only, the question should be introduced and clinical features or diagnosis, treatment planning, references has to be mentioned. Comes to know this answer is having these headings are there. So I'll look into. So it becomes easier. The student should concentrate on this particular answer paper in theory.
Very well explained, sir. I would now like to hand over to Dr. Rajshri. Rajshri, please take over.
Rashmi, switch on your mic.
Thank you so much. Thank you so much, sir, for your marvelous appraisal and guidance. Now, I would like to invite Dr. Akshay Daga, Professor, Department of Oral and Maxillofacial Surgery, to propose the vote of thanks. Over to you, sir.
It has indeed been a great pleasure having you online for guiding the students in such an amiable, such an eloquent way, sir. You can make out by the number of questions that the students are really interested in making them understand right at the time how they should go about the exams. And the best part of it was that you have covered each and every subject in detail about the theory and the practical aspects. A lot of questions are still remaining. That only goes to show that the students were really engrossed in your presentation. And as far as I'm concerned, I would have been really, really happy if someone like you would have guided us when we were preparing for our final exams. So to all the students, this is a great opportunity. Understand what sir has said in details about all the subjects specifically. Thank you very much, sir. It has been a great pleasure to listen to such a doyen in maxillofacial surgery, the vice president and the teacher of teachers like Dr. Bansal said. You have been my examiner as well, so I can really vouch for the authenticity of all your caliber and your expertise. Thank you again very much. It was great listening to you, sir. Thank you again from all the students and the staff.
Thank you, Akshay. Thank you very much.
Thank you, one and all. Have
Thank
a
you,
great
Akshay.
day.
Thank you, sir. Thank you so much, sir. This is a small token of
Thank you.
appreciation which we are going to mail you
Yeah.
shortly. I have just displayed it.
Okay.
Thank you so much, sir,
Okay.
for giving your precious time. Thank you. Thank you, everyone.